Hello, I'm Dr. John Dye, and I'm going to take a few minutes to give you an overview of the BioLinguistic Kinesiology workshop. I actually call it BioLinguistic Kinesiology and Clearing because on the second day we actually go into the mind-body process using the muscle test more or less as a psychokinesiology tool to find particular emotional or mental core issues and blocks. We learn to track and find the underlying cause and do some processing, including tapping and clearing techniques. And yet on the first day, what we're teaching are the basics of muscle testing. And we call it kinesiology or muscle testing. And I recognize that there are many different schools and different practitioners that use muscle testing in different ways. So the term biolinguistic kinesiology, I have come up with this term to suggest that the bio is body. We're using it as a reflex, using muscles to assess things that are happening in the body, and that includes things like where in the body there might be energy blocks or energy loss, if you want to call it that, in various organs or chakras or areas of the spine that might be in some way holding a stress pattern. So we can use it to assess the body. But the biolinguistic aspect involves using language. And language is how we communicate and hold the meaning, both emotionally and mentally in our belief systems. And I believe that not only can the physical body hold stress and become ill, but there can be holding patterns within the emotions and within the thoughts and the mental body that are a primary source of illness. So using the biolinguistic kinesiology techniques, the practitioner will learn to interview and track the weakness that we see or the symptomatology that we see and track it into finding core issues in any of those realms of physical, emotional, mental, or even spiritual. So in a way, I am teaching a very intuitive process and an intuitive way of involving an interaction between the mind-body interview, the skill of the practitioner, and the subtle, energetic, and intuitive assessments that we use with biolinguistic kinesiology. I'd like to give you a little brief background of how I became involved in this. And it goes back to the early 80s when I was a new doctor. And at that time, I had patients that would ask for muscle testing and ask me to test their supplements or use the testing in various ways of finding the problem. And I have to admit, in those days, coming right out of my science background and being a healthy skeptic that I was, I had a lot of skeptical doubts about at least the ways I was seeing muscle tests used to diagnose and to determine treatments. And, you know, it wasn't until I had a practitioner who used it with me as myself as the client that I began to see the subtle use to discover and to maybe reveal subtle energy patterns that are really important. I began to look at it as a way of accessing the subconscious mind, maybe in a way similar to certain types of hypnosis, where the muscle becomes an indicator of a message that comes from some intuitive knowing. I began to realize that we could use it to assess in this intuitive, energetic way. And so I took some workshops. I took 3 or 4 different trainings from different practitioners in the use of muscle testing tools. And I developed my own way of teaching. And part of that is the importance, since I've noticed a lot of practitioners using muscle testing in different ways, I began to make it very clear from the beginning that we have to set our intention. The intention needs to be communicated to the client and be clear within the practitioner what it means when the muscle test weak. And the type of information we're requesting requires clear intention. So we can test to discover patterns of stress or how stress has an impact on the body. We can test for core issues of stress in the mental emotional realm. And we can test for support. We can ask whether this particular treatment or protocol has this intuitive, subtle resonance with our client that it would support. I sometimes have noticed, or I think about this, that there are patients who just throw the little prescription pad down in the trash on their way out the door when they know pretty much by the end of the visit that they're not going to do it. And my sense is by using the energetic tools, we can check not only for the highest good of the patient and for what resonates, but when they test strong, they often have a buy-in and they know that they resonate and they have this sense that we found the treatment that they're ready to use. And I believe that the compliance of the patient goes up when they have this type of agreement that we can find when we do the muscle testing. Well, I've also decided that it's important to teach what muscle testing can be used for and what it should not be used for. As I mentioned, I use it primarily for intuitive, energetic types of assessments and providing guidance. On the other hand, I have a clear belief that we need to have integrity and responsibility around communicating what it cannot be used for. And that when a client wants to know through testing something that really should be used in a logical medical evaluation, if they want to diagnose whether this problem is due to a particular condition, is this a liver problem, or is this particular pain in my leg, is it a fracture or not a fracture? I believe that there might be some intuitive way of deciding how to support that client, but the actual diagnosis needs to come from the lab testing or the procedure or the x-ray or the evaluation that leads to a medical diagnosis. So when we're using it for an energetic assessment, it's often to guide the decision making and to find the more subtle, energetic, underlying cause of illness in a way that conventional medicine has no method or no way to dive into that realm. So there are clear ethical guidelines that get presented in the workshop, and in the course of it, we'll learn to test for intolerance to foods. I have people bring little samples of foods that they would like to test, and we'll look for what you might call food intolerance or food and environmental. There's ways to assess for environmental impact of certain products and medications and so forth, how the body resonates with that. And by the end of the first day, we'll begin to assess on the mental emotional realm, looking for those core issues and beliefs, which on day 2, I teach a process that is a clearing process that involves a mind-body interview and tracking particular emotions or beliefs that might be in some way causing stress that impacts health. And we will test those beliefs and emotions for their impact. And the clearing technique involves a way of locking in the primary toxic beliefs and emotions, locking them in a certain position and posture that they will hold, and then they tap in various places on the body that come out of this clearing process. You'll learn during the second day. And a profound clearing can take place to maybe you could say release that old stressful pattern, the toxic emotion or belief in some way clears with the protocol. So the participants will learn this clearing technique on day 2, and we'll have a chance to do several breakaways to practice all the techniques and processes we teach. And then you'll come away with a workbook outlining step by step each of the protocols and breakaway sessions that will be outlined in clear detail. So that's the workshop. It's a 2-day workshop. I'm hoping that you will have a chance to experience it and use it for your own personal healing. And then gradually, as you're able, you should be able to integrate this into practice in a very rewarding way. So hope to see you there, and take care.